One more important topic from the 30,000 series, that is the cardiovascular series. In that, we are going to see the extracorporeal membrane oxygenator. And it is basically we put the oxygen back into the blood and remove the carbon dioxide. Now, when do we use this? That we will see. Extracorporeal membrane oxygenation, which is also called as a ECMO or extracorporeal life support, ECLS, is an extracorporeal technique of providing prolonged cardiac and respiratory support to person whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. ECMO involves centrifugal pump, heat exchanger, and oxygenator. So basically, when the heart or the lungs aren't performing properly, maybe there could be the lung disease or the heart disease, then that time we give this life support or the membrane oxygenation, which is called as a. So there are two separate configuration of ECMO. One is Veno-Venous and Veno-Arterial. In Veno-Venous, it supports heart and the lungs, and it requires two cannula. One is in the large vein and the other one is in the large artery. While the Veno-Venous used mainly for the lung support and which requires one or two cannulas placed in vein. Then we also divide the ECMO into peripheral and central. Peripheral involves inserting the cannula into the large periphery artery and the usually the femoral artery, and the vein is usually the femoral vein, and it can be initiated percutaneously, that is through the skin or through the surgical cut, which is called as a open. While the central ECMO involves inserting cannula directly into the ascending aorta for the atrial return and the right atrium for the venous drainage, typically performed in operating room and require a surgical incision. So that is the central ECMO and peripheral ECMO. Now, this is the very interesting chart that is there in your book, and which talks about the cannula insertion, and in that also we use the various method of cannula insertion, the percutaneous, open, and sternotomy or by the thoracotomy approach. So these are the three ways, and this is for the insertion, this is for the reposition, and this is for the removal, which is also called as a decannulation. And if you see, the codes are divided depending upon the age of the patient. So the percutaneous have below 5, above 5, and then you open also has two range, and the sternotomy thoracotomy means when we cut open the chest and do it. And these are the code only for the management. Okay, so this is a very important diagram, and it's very easy to understand. Then the other cannula procedure is arterial exposure, insertion, left heart vent, and removal of the left heart vent. So kindly read all the code language properly to get the correct code. Now, what are the important guidelines for the catheterization is repositioning of the ECMO cannula at the same session as insertion is we do not separately report. If cannula are removed from one vessel and new cannula are placed in different vessel, report the appropriate cannula removal and insertion code. Here what is happening is we are removing from one vessel and the new cannula has been introduced either in the different vessel or different vessel, then we need to code it, and the fluoroscopic guidance used for the cannula repositioning is included in the procedure when performed, and so that it should not be separately reported. So these are the very three important guidelines. So there are two different kind of cannulation. One is a peripheral and then the central. In the peripheral ECMO cannulation, the blood is drained from the inferior vena cava via femoral cannulation. It passes through the centrifugal pump and oxygenator and is returned to the patient via femoral artery. So this is the peripheral cannula is can be done percutaneous and open, and this is the I made a quick chart. These are the code for the insertion, reposition, and removal, and this is for the peripheral cannula. Okay, because we use the central. So these are the code for the central cannulation. Again, you have the code for the insertion, reposition, and removal. And the code differs depending upon the age of the patient. And central cannula is usually by the method of sternotomy or thoracotomy. So following are the code for the daily management of the Veno-Venous, Veno-Arterial. Then this is the initiation code for the Veno-Venous and Veno-Arterial. And this is the arterial exposure with a graft. So pay attention to the language and then you can choose the right code. Now, whenever you are solving the question related to the ECMO, you first need to identify the type of the cannula, whether it is a peripheral or the central. Secondly, is identify the type of the procedure performed, whether it is the insertion, repositioning, or the removal, which is also called as a decannulation. Step 3 is identify the approaches, whether if it is a peripheral cannulation, are you doing it percutaneously or open, and central cannula, is it a sternotomy or the thoracotomy, and age of the patient is also important consideration. So let us take certain examples so that you will understand this concept better. A 6-year-old requiring a ECMO, open insertion of a peripheral cannula, what is the correct procedure code? And we have this option. So let us collect our data. This is the ECMO and it is an open insertion. It is a peripheral cannula and the age of the patient is 6-year-old. And then apply it. This is the percutaneous peripheral cannula. This is the open peripheral cannula, and we are looking for the procedure of the insertion, and age of the patient is 6-year-old. So by taking everything into consideration, we pretty much know what's our answer. So yes, 33954 was the answer, which talks about the peripheral cannula open insertion, and the age is also appropriate. Now this is an operative report, so one must pay attention to all the important things. A 7-year-old boy is admitted to the hospital due to severe dehydration and requires a peripheral venous access for the administration of the fluid. Dr. Smith, a pediatric intensivist, perform a percutaneous insertion of the peripheral cannula into the child's right antecubital vein to begin the intravenous hydration therapy. Several hours later, the cannula becomes dislodged due to the child's movement and is no longer in the proper position for the venous access. After the careful assessment, Dr. Smith determines that the cannula needs to be replaced. He removed the dislodged cannula from the right antecubital vein and proceed to insert a new peripheral cannula into the child's left antecubital vein percutaneously to ensure proper access for the ongoing treatment. What will be the appropriate CPT code for this procedure? So there is a lot of data. First of all, we need to find out the age of the patient is 7 years. What is this? It's a peripheral cannula, and how did they put it percutaneously? Now what happened is initially the cannula was put in the right antecubital fossa, but because of the moment of the baby, it got it got dislodged, and then they moved to the another hand, and they proceeded insert a new peripheral cannula into the child's left antecubital vein. So let us see. First of all, we need to check. It is a percutaneous peripheral age 6. Sorry, because the 7. So we will pick up the code. Now we have this code. So we need to pick up that code. And in this case, what has happened is they have removed it from the right side, and then they have insertion happened to the left side. So the two things happened in this particular encounter. So we will have to take into that consideration. So whether do we have to code for the two things or the one things? So D is the correct answer, because if the cannula is removed from one vessel and the new cannula are placed in a different vessel, we have to report the appropriate cannula removal and insertion code. And both the things happened because they removed it from the right antecubital and then put it back, inserted a new cannula into the left, and that's why we will require a two code, and we will zero down the answer D. A premature newborn with acute respiratory distress syndrome has been admitted to the ICU Despite use of the mechanical ventilation, the baby's continuation continued to deteriorate, and the decision is made to place the baby on the Veno-Venous ECMO for the lung support. Dr. Jackson, the critical care physician, insert a Veno-Venous cannula. The baby then received 48 hours of daily management of the Veno-Venous ECMO by the physician, which CPT codes are reported. So now here what has happened is the baby is placed on the Veno-Venous, and we need to check what is the code for that. Now we have to code for the 48 hours of daily management. So 24 hours is one day, so we will have to check that. And whenever it is a daily management, the word is daily management. So if it is a 48 hours, we will have to code for each day, and we will see the code. Now for all the code 33946 to 33945, we are not supposed to put the modifier 63 because these codes are mainly for the babies. So there is no need to put the modifier 63. This is a parenthetical note which is there below all these codes. So kindly read that note very carefully. Now we have enough data. So this is a Veno-Arterial 33949. It is a Veno-Arterial. So option C goes away. 33948, it is definitely the daily management, but it is a daily management of the Veno-Venous, and we are talking about 48 hours. So even the option A goes away. In between B and D, the option is very, very simple. Yes, so the parenthetical note below 33946 to 33949, where it is very clearly given, do not add the modifier 63, helps us to zero down the option D. A 30-year-old patient was admitted to the hospital on Monday due to the pulmonary embolism and was started on ECMO support. To initiate ECMO, a Veno-Venous cannula was inserted through the femoral vein via percutaneous incision. However, on Tuesday, the physician determined that the cannula needed to be repositioned to ensure proper blood flow. Cannula was repositioned via same approach under the fluoroscopic guidance. How should the procedure perform on the current day we coded? So, on Monday the ECMO support was started, and on Tuesday they had to do the repositioning of the cannula, and we have been asked to code for that repositioning day because they have clearly mentioned perform the current day to be coded. So let us look at our code. So 33952 is the code for the insertion. They are asking us to code for the repositioning. So in between 957 and 958, 957 is up to age 7, 958 is above age 6, and that is the code we are looking for. So 33958, we will consider that code, and let us zero down our answer. So yes, 33958 is the answer, and the fluoroscopic guidance used for the cannula repositioning is included because if you read the code, it talks repositioning of the peripheral arterial and venous cannula percutaneous 6 years older include the fluoroscopic guidance. So we don't have to code 77001 separately, and that's why we are zero downing the answer 33958. 63-year-old patient require extracorporeal membrane oxygenation for acute respiratory syndrome. The cannula insertion is through an open approach via surgical incision in the chest. What is the CPT code reported? And we have this code. Now, the 33954 is definitely the series for the peripheral cannula. Our cannula is insertion is through an open approach, and it's a central cannula because via the surgical incision in the chest, and the age of the patient is 63 years. So we will take down the code 33956, and let us see what is this 32100 code is. So yes, the correct answer is 33956, and if you see the code, it is the insertion of the central cannula by sternotomy or thoracotomy, and here we can see the cannula insertion is through an open approach and via surgical incision in the chest. So that takes care of the word sternotomy and thoracotomy. And if you see that in the parenthetical note, there is a mention that do not report 33955 and 956 in conjunction with 32100. So I cannot choose the option D. So correct option is C. And this is the last slide, and we finished with the ECMO, and the next important thing is the appendix L.